So our presentation's titled Improving Physical Health in Mental Health. We will share staff and service user perspectives from our inpatient mental health setting in East London. Our presentation begins with an oversight of the rationale, role and relevance of physical health within mental health services. We will share our work on driving a smoke-free culture and developing a sports pathway. Then we will share the intentions, implementation activities and impact of our initiatives and conclude with lessons learned. The key principles we're keen to share are that physical health and mental health are inextricably linked. Furthermore, people with mental health problems have worse physical health and significantly worse life expectancy. We also share our view that occupational therapists are in a unique role with our training, knowledge and skill set to work in both domains.
So to speak about some of our local achievements, we've been a smoke-free hospital for over 7 years. We recognise we have significantly higher smoking levels than the general population, 3 times higher, and we've set out to engage and support a quitting in mind culture. We have also made progress developing a sports pathway. We have improved accessibility, choice and opportunity for physical activity within our service. Our smoke-free work. All OT staff completed nationally recognised training with the NCST. We were then equipped to discuss smoking status and offer support. We structured support as seen in the flow chart on this page. And the structured support involves providing individualized support, utilizing evidence-based practice from NICE guidance and NHS England. We devised plans for behavioral and pharmacological support using these sources. This has involved innovation and creativity to engage patients and achieve positive outcomes, such as collaborative work, with patients working with us to provide the service, and some of them have taken the NCST Level 1 course, a Quit Stop Cafe group in the Recovery College, recognizing and rewarding smoke-free days, sustainable change with many patients cutting down or quitting.
So our physical activity pathway. We established a pathway with more staff able to support access to the on-site gym. We captured personal goals and provided support to support these goals. We've built on the physical activity opportunities available with yoga, walking groups and community partnerships such as Sports for Confidence. We have a popular incentive scheme to reward engagement and participation. Last month, we recorded that 88% of the patient population were inducted to access the on-site gym. Our intentions towards meaningful, measurable and merited service provision. Our professional practice skills ensure collaborative, meaningful activity provision. Our person-centred plans and personalised goals support measurable outcomes. Our philosophy for evidence-based and best practice ensures merited programmes. So the impact of our work. So we have strived to make an impact across 3 levels, changing patient experience, and at a team level, providing support and championing change. For example, communicating clear messages. So for smoke-free, 28 days smoke-free means 5 times more likely to quit smoking. And for physical activity, 150 minutes a week is the target for physical activity. We strive to contribute to the wider health landscape by driving and sharing good practice. We are recognised for good practice towards smoke-free in the publication by the Department of Health and NHS England improving the physical health of people with mental health problems. So we've shared 2 videos to share the service user perspective.
Hi, my name is Liz Hendel. I'm going to tell you about my experience with mental health services. I was an inpatient for 10 years, 7 years at Beckton, Cygnet Beckton, before I got discharged last April. My diagnosis when I first came in was anorexia and borderline personality disorder. But yeah.
Hello, my name's Tara. I'm the occupational therapist on Hands Ward who also worked with Liz and was involved with the sports program while she was here. So Liz, how did you get involved with physical activity whilst in Beckton?
When I first came here, I wasn't allowed to do any physical activity because of my anorexia and how underweight I was. It's something that I've always loved to do though. I'm sports mad, to be honest. But slowly and surely, the staff here were trying to get me more and more involved. So it started off with the ward manager taking me down to the gym on site and just letting me work for, say, 10 minutes at a time in the gym. Then this became increasingly regular, and it got to a stage when I was going to the gym every day with OT staff supervising me. It also gave me an incentive to eat, because I knew that if I ate at lunchtime or dinner, then I'd be able to go to the gym. So it benefited me there, and got to a stage where I was eating pretty normally, and I was no longer anorexic.
That must have been a very meaningful activity for you.
It's very meaningful.
Yeah, oh, that's good. What opportunities for physical activity did you have, or what other ones did you have in the gym?
There's so many that I've had at Beckton. Sports for Confidence is probably the main one, where we used to go once a week and you'd have an occupational therapist and a fitness instructor, just playing sports with us. It's good fun.
It was.
I've also done walking football. I used to play football as a child, well, as an adult as well, so walking was a bit hard, but it was good fun. Swimming, we used to do that every week as well. Get Active was a group we had on the ward, so you'd play table tennis or well, there's lots of things we did anyway.
We do a few rounders and things in the park as well.
Yeah.
There were some picnics, weren't there?
Yeah, in the summer as well, we did like a picnic in the park, played lots of sports, lots of rounders, yeah.
And when you moved into the community, how were you able to transfer that sports or engagement in sports?
I think it gave me confidence, something I'd been lacking a lot before hospital. And because of the sports for confidence in the area where I live, it kind of flowed nicely. So the OT here got in contact with the OT in Chelmsford, in my area. And it was a good link between what I was doing here and what I was doing in the community. It also gave me confidence to join other groups. Bat and Chat is one of my favourites, which is table tennis with a lot of chatting, but I'm better at the table tennis than chatting. I also go swimming pretty much every day and do aqua cardio 3 times a week, and I go to the gym on days when I don't do anything else. It's just given me a lot more confidence.
Yeah. And just really reflecting on your experience, how has physical activity been helpful in your day-to-day?
For me, if I don't have the physical activity, my mood is very low and I'm close. I'll be very, very low. It's helped me get out, have structures in my day, meet other people that I wouldn't necessarily meet otherwise. Yeah.
Oh, sounds good.
Yeah.
I'm glad. And the one thing we didn't talk about is that you also were able to explore possible vocational roles. Tell us a bit about that.
Yeah, so from the confidence I gained from doing all this sport, I now volunteer a couple of days a week in charity shops. It's a start. I'm building it up slowly, but I would never have been able to do it if I hadn't joined Sports for Confidence or worked with the OT staff as I have done.
I was still thinking about even a more challenging vocational and your qualifications you got. I remember how tricky it was.
When I was here, I suddenly had this crazy idea, let's become a referee. And so the OT staff supported me all the way, and I got the refereeing qualification. I'm not sure how good I am as a referee, but it's fun trying.
I think it also gave you that opportunity to explore how far you could push yourself, because it was really difficult.
Yeah.
And you did,
it was hard.
Go out of your comfort zone.
I did. The first session we had, I actually left early because I couldn't take it, but the OT staff, the nursing staff all helped support me, and I went back in and I got the full qualification. So
that's obviously transferred into going into the charity shop and, facing any fears and being able to do those new experiences.
Oh, the physical health things that I've had to do over the last few years, or have done, they've benefited me so much. They really have.
Especially your that link.
Yeah.
That's really great. Thank you for sharing that, Liz.
Thank you.
My name's Shelly. I'm a patient at Cygnet Beckton, and I've been here a year now.
Hello, my name's Tara. I'm an occupational therapist on Hands Award, and I've worked with Shelly since admission and also supported her in Quit Stop Cafe. So Shelly, how long have you been a smoker?
Since the age of 15, I'm 44 in a couple of weeks.
Okay. And how have staff at Cygnet helped you to maybe cut down on cigarette?
It helps that the other patient and myself go down in groups 5 times a day, because we only smoke 2 or 1.
Okay. And in between that, what do you do to help with the cravings?
Sometimes I use a motor pen, but because of the money allowance, I rely on a nicotine inhaler.
Okay, so you can get a prescription for the inhalator, and that's given to you by the hospital. Okay, and do you want to tell us about the different types of Moti pens and mojos that you've had whilst being in hospital? Because we started off with the mojos.
Yeah, the motor pens last longer than the mojos. The mojos only lasted me about an hour and a half, whereas the motor pens last me about 3-4 hours, so it's a big help.
Yeah, it must cut down a lot on the cost and make it easier. Okay, and have you attended any of the Quit Stop Cafe groups that we have in the interward?
I attended a couple of times, and I found it useful, but maybe when I'm in the right frame of mind to quit smoking, I might attend Quit Stop more.
Yeah, it's also a group to help learn about the different methods, or have quitting in mind, so just to have that conversation, and it's been great to see you at those meetings. But we also have like one-to-ones on the ward, don't we? And thank you, Shelly. That was great speaking to you. Okay. Thank you.
Thank you.
To summarise our lessons learned, so we believe important aspects have been meaningful, robust activities offering choice and opportunity. Collaboration is key. We focus on the doing with aspect on the ladder of participation. Having a measurable activities, so personalised goals and care plans and incentive tools to support progress. With focus on merited programmes using evidence-based practice and recognising best practice. And overall, working together for sustainable changes. Thank you.